Good morning, everyone. My name is Jennifer Hackman, and I am a program coordinator for the Delta Regional Community Health Systems Development Program with the National Rural Health Resource Center. I'd like to welcome you all to today's Learning Collaborative. We're glad you could take the time to be here with us this morning. Before we get started, I'm going to go over a few housekeeping details. When you call in, your phone line will be muted. To unmute or remute your individual line, press *2. Once you call in, please keep your computer speakers on mute to avoid any echo or feedback. You can communicate via the chat box on the left-hand side of the screen at any time for any questions, and we'll go over questions at the end of the presentation as well. The file share box located right below the chat box will have a copy of today's webinar materials that you can click on the name in the file share box and click download to download that file directly to your computer. Today's webinar will be recorded, and a link of the recording will be provided to you once the recording is uploaded to our website. Now I'd like to turn it over to Kate Stenyum at the National Rural Health Resource Center to get us started.
Great. Thank you so much, Geneva, and welcome everyone. I hope that everybody had a really nice, relaxing, and safe Thanksgiving weekend, and I'm sure Monday morning we're all right back at it, but hopefully everybody's feeling kind of refreshed and rejuvenated after the holiday. I'm so glad that you are all able to make it this morning. I think instead of doing a roll call, what I'm going to do, because it will be helpful for us and for Lee to see who is on the line. So if everybody could just take a second, and if you look over at the left-hand side of your screen, at the very top, you'll see an attendee list. But right below that, you'll see a box that says chat, and everyone. If everybody could just take a second and type in that chat box what facility you're from, that would be absolutely wonderful. So again, if you can just see that chat box, and if you can type into there what facility you are from so that all of us can see. Oh, I see everybody's typing away. Thank you so much. Cindy, if you could pull up the PowerPoint, and we'll go ahead and get started. I know Lee has a lot to talk about. So I just wanted to take a quick second here and welcome Lee back to the Delta Region Community Health Systems Development Program. Almost all of you had the pleasure of meeting him at the summit in September, which strangely seems like it was kind of just yesterday, but it also feels like it was a long time ago. But Lee came in and really did an excellent session with all of you on communication and improving our internal communication strategies at the summit. Backed by popular demand, we had so much wonderful feedback and follow-up after the summit, and a lot of people outreaching to Lee and wanting to have more help and support from him. So we brought him back, and today he is going to be talking to you about recruitment and retention strategies. So this is just a list right here of all of the communities. All of you guys, I think, know each other well now, have been with each other for a few years. So this is the 2017 and 2018 communities. And then as a reminder, this program is supported by the Federal Office of Rural Health Policy and the Delta Regional Authority. And with that, I am going to be quiet, and I am going to turn things over to Lee to get started.
Good morning, all. Hope all are well. I understand that some got snow, like up in Duluth. Fairly amazing, but what I'm looking for right now is a way to, oh, there it is, to move my slides. Just making sure I had it. You know, folks, when we start talking about recruiting and retention, I subtitle this as "We're in such a mess." The problem we're facing is, when I put it together, I just did a quick estimate, about 1 million workers were short. That means if every single person that was unemployed found a job today, we'd be 1 million short. That number is a little bit off. It's 1.37 million. To give you a flavor of how things have changed, during the peak of the Great Recession, we had 6.4 workers per opening. Today we have 0.8. These are really challenging times. Real quick, Google search shows healthcare is looking for 2.3 million workers in the year 2025. We got a problem. What that basically means, if we don't see like a mega recession or something like that, then actually the viability of organizations, of hospitals in particular, are going to be, because they're labor intensive, is going to largely depend on their ability to recruit new staff. Okay, there we go. Let's talk about how to do this. Now, in the year 2000, I worked for St. Francis Medical Center in Grand Island, Nebraska. We had about 1,200 employees, $150 million gross revenue, about a $50 million profit margin. We were pleased with how things were going, but I couldn't get enough staff. So I've been at this now for 19 years, working with shortage of labor and what do you do and how do you get out of these god-awful messes. And it's generated some real interesting results for me. Let's start talking. To begin, you got to know what's your labor market look like, and that's going to take some looking at data. Oh, one slide ahead here. There you go. You got to look at some data. For example, looking at total turnover. You know, that statistic is going to be really intriguing. My wife was an intensive care nurse for many years. When I was going to school at Virginia Tech in Blacksburg, Virginia there, that town has 42,000 people, but 30,000 of them are students. That means that hospital is staffed mostly by spouses of students, which means their potentially avoidable turnover hopefully is very small, because their unavoidable turnover, because students are leaving and their spouses are going with them, is massive. Got to be. That's going to be important to know that. First year turnover, I'm going to talk a lot about that. That's just an incredibly important statistic to track. I actually like 180-day turnover. Time to fill. I worked with a facility in Colorado, pretty good size one, and their days to fill were just off the chart. They were up over 2 months. And we said, why? How can that be? We started talking to them and in fact found that what was going on is they were, the directors were saying, oh my God, we just don't have time to do all this interviewing and all this stuff. We just can't possibly get all this done. We had to set them down and say, folks, if you don't hire replacements, we're going to have to start shutting down services, because you just can't have time to fill be that long. That's a statistic to track carefully. The last thing, and this is my all-time favorite, I check this every single Friday, job vacancy. If, in fact, your recruiting is working and you got high turnover, you will survive. If you have low turnover but you can't recruit, you're going to shut down. That is, in my mind, the most vital statistic to track in turnover. My suggestion, not only do data analytics on this monthly, report this to all the directors in the place, have good discussions about it, find out what's going on with your data coming out of recruiting and retention, and also talk about it at the board level monthly. I think it's that important. Now get to know your labor market. Where are you getting your people? Some people call this a source analysis. When you go out and look for where did recruits come from in the past, and by the way, what nightmares do you see coming? One time in Central Nebraska, for some reason, the military decided basically to recruit every medical healthcare kind of student out of the colleges in the area that they could. And thank God that was not a time we had shortages, because it took us 2 to 3 years to get over that 1 year where there were almost no graduates available to us. If we get hit by something like that now, that would be disastrous with the terrible shortages. Having said that, the question then becomes, what sources are available that you've not used before? Look for places that you can recruit that you've not recruited again, from before. I'll tell you what we did at St. Francis. I'm going to use a lot of my time, because I was at St. Francis 29 years, so a lot of my stories will be from there. Basically, what it amounted to is we found ourselves in a situation we could not get enough staff. As I said, we created with the state government the RAMBO program, Rural Allied Medical Business Occupations. We started recruiting people who were poor, they living at poverty level. We set up grants through the state, got them trained so that when they were done, they were respiratory therapists, they were histotechs. We had a whole long list of jobs that we could get, that when they were done, they not only had a livable wage, they were then taxpayers. It went very well, and they stayed forever. When they came to work for us, they just hardly ever left. Extremely loyal to us, which was lovely. And what does the data tell you that's working? Look at your sources. Which are the good ones? Which are really not producing that much for you? And which ones are gold? With all of these, in particular the golden ones, just go a little nuts on building relationships with key players there. Have at least one, preferably two, extremely strong relationships with people. From that, maybe you'll add more, but get a bunch. Now, how we got to high school counselors and science teachers, we brought them to the hospital. We invited them to the hospital and put on an absolute white tablecloth dinner for them. It was extremely nice. And it was just over the top. We'd have 40, 50 people in the room. The first person to come in and present was a highly revered surgeon. And he came in and talked about what's it like to be a doctor. And then we brought in a nurse who was well known in the community to talk about what's it like to be a nurse, and then a med tech and a respiratory therapist. And we gave all of them printed materials that said, here's what these jobs look like now, here's what they look like in the future, et cetera, et cetera. They got a fully extensive array of information about the jobs that are available in healthcare. They don't have that right now. And by the way, we not only want to give it to them, we want to make it really easily available and put it online for them too. At the colleges, we didn't find that worked so well. So we started taking key faculty people to lunch. And if possible, we'd hire them so that they could keep their skills up to date. And by the way, they were keeping their skills up to date in our facility. The goal of all this is so that they're going to refer their best students to you, and they're going to work with you to improve their programs. You can give suggestions to them, and they'll hear you, so you can get improvements in the clinical people you have coming out. Start teaching people young. I sat down with the principal, or pardon me, the superintendent of schools of Grand Island, is a very, very decent man, and said, if you think healthcare costs are high now, wait till the shortages hit. Our payroll is $50 million. What do you think it's going to be like if we have to go up 20, 30%? Medicare is only giving us 2% a year, so you're going to be paying that. If you want to hold down the cost of healthcare, you got to work with us. And he got it. He went to work. He readily welcomed our clinical people into the classes at the high school level, and they would teach a class. And the teachers liked it, gave them a break, and the students really enjoyed it. And of course, we were teaching the students about how they could use biology in the real world. We'd have them look at slides that were from our hospital, some fairly impressive things that hook people to us, if you would. We did the same with college classes. Not as easily done there for some reason. We invited students and their parents to come meet with us, and we would go typically to the school. That seemed to work better than having them to the hospital. More would show up if we invited them to school. We invited the students and their parents. Now, two reasons we did that. I talked to a gentleman who had been a principal at a senior high in the area who had retired, and I said, who really makes a decision about where kids, what careers kids go into? Is it the students or not? He said, well, every parent out there is probably going to say, oh, the kids make their own decisions. The truth is the parents have a really big impact. It's subtle most of the time, but they do kind of nudge and et cetera. I remember my son calling and telling me that he was going to drop out of computer science and become a history major, and I said, nope. I wasn't so subtle. I was a little bit more direct. I said, son, if you like computers, that's the future for you. He got his PhD in artificial intelligence and is doing quite well now. Any case, for most parents are more subtle than me. But we knew that if we get the parents in the room with the students and we're telling the students about what it's like to work in healthcare, well, we're also telling the parents. Part two of that, and I wish I would have tracked this, but we ended up recruiting quite a few of the parents. They came to work for us. Next up, we looked at, remember the TV show Crime Scene Investigation? Well, we put a twist on it. We call it Career Scene Investigation. Our local mall had a fairly large conference room. We grabbed onto it and began to have meetings with people there of all ages, but in particular young ones. And we might have a surgeon come out and do open heart surgery on a heart that we had gotten from the meatpacking plant. We would show people how to do injections using oranges like they do with nurses, et cetera. There was a whole variety of things we did there just to teach them what it's like. In a pretty short, moment, they could just stop by and see it done. And we got pretty good attendance eventually. It didn't start strong, but it got there. We started talking to that same superintendent and said, can we start putting together some classes at the high school level? Now, this is before this was done very much. We traveled to Tucson and Bartlesville, Oklahoma, and places like that to see what they were doing. We brought it back to Grand Island and replicated it, and it worked. Now, having said that, the series of courses we put together were things like sports medicine. We didn't call it physical therapy because we didn't get anybody sign up for physical therapy classes. When we called it sports medicine, we got a whole crowd. So we had to tune the class to the students and what they were interested in. But the beauty of that, when they graduated from high school, they were ready to go immediately into the coursework at the college level. Now, having said that, I mentioned we had slides and things like that. We had some really good ones. We actually had a patient with leprosy. So we got a slide of the cells associated with Hansen's disease or whatever it's called. We had some really good car wreck x-rays. People who had some pretty serious broken bones, et cetera. We had a variety of things that we could show to people when they went to the healthcare pathways in high school. They were looking at materials from our hospital. It was local stuff. Then I'm going to tell you, we didn't really emphasize recruiting. We really emphasized building a pipeline. Recruiting is what you do if pipeline building doesn't work. Pipeline building is you know who you're going to hire before the job ever opens. I really got this from our director of pharmacy. John was quite amazing. All the time. He was continuously talking to other pharmacists in the area. He'd buy them lunch. They'd go out and have drinks together. They'd go out and do things together. And when the time came that he'd have an opening, and this actually did happen, he very often would call that person that he was going to hire for that spot the same day. Our time to hire for pharmacists was under a week. The hospital about 40 miles away from us that actually paid better than we did, that was a little bit bigger than us, it took them over a year. We did that repeatedly. We constantly started stressing to people, build the pipeline, get to a point that you know who you're going to hire before the job even opens up. It gets your statistics working extremely well, and that means you have less overtime, less hassle, you're more fully staffed, and life's a lot easier. If the pipeline doesn't work, then you got to recruit. Okay, if you're just not getting what you need, you got to hustle out and get the recruits. Well, having said that, got the wrong slide up. There you go. You got to be innovative. When I first started to work at St. Francis in Grand Island, we were so broke that we had to borrow from the mother house to make payroll. We had so little money that we had to actually not talk to the banks because they wouldn't talk to us. We went to the mother house and said, can you help us? And they did fund drives to, oh, I didn't do that. That was automatic. There we go. Well, my slides are jumping. Hold on just a minute, folks. Pardon me. I'll move my arrow. I had a lady who was, 65 years old roughly, who was in charge of recruiting. Mary was amazing. We could not afford the big shiny things that all the other hospitals had, these great big displays. And oh my gosh, they gave out all sorts of things to people to draw them to their booth. Mary didn't have that. What Mary did was genius. She got a little lace tablecloth that she put on her table, and Mary could make cookies that were virtually perfect. She made cookies that were really quite imperfect. They were obviously homemade, and she made a bunch of them. And then she had photo albums. So when you went to Mary's job booth at the job fairs, you got a cookie made by Mary or somebody. I don't know who she had all make them, but she got lots of cookies. And she had this photo album, and she'd tell you stories. And people were not being recruited. They were talking to their grandma. And she kept us afloat. Even though we were the worst payer in the area at the time, she kept the place staffed all by herself. We only had one recruiter. I went with her as I could, obviously. Story of MedTechs. MedTechs is tough. That's a category that's going to be very difficult. There's not very many trained each year. They're anticipating severe shortages, and their average age is high. Had actually a hospital try to recruit some from the Philippines, and it was an incredibly onerous, long-term effort. They were successful, but oh my, what an effort. What we did with MedTechs, we did a little bit of lightweight pipeline building. We got names of MedTechs when they were sophomores. The MedTechs at the hospital each took a couple of names and started corresponding with them. In those days, email was finally available. We didn't have it when I first started in this business. But what we did then is, came time for approaching graduation, we invited every MedTech that we'd been in touch with to come to Grand Island, and virtually all of them said, sure. We picked them up in a limo in Omaha. We're the only program in the whole state of Nebraska is in Omaha, Nebraska. that's where they're training them. And we brought them, 150 miles or so out to Grand Island in a limo. They were to spend the day with us. They did. What we didn't count on was a snowstorm. So they spent the night, and the med tech stayed at the hotel with them. And they had quite a discussion. They got back to Omaha on the day of graduation. All the young ladies got a rose from the person that had been staying in touch with them. I don't remember what the guys got, but they got something similar. We got applications from virtually all of them. Now, having said that, I'm going to start talking about reputation. Everyone is a recruiter if your place has a good reputation, and you've earned it. If you really work hard to build a reputation that, oh my gosh, this is the place to work, then everyone becomes a recruiter for you. So when you encourage people to recruit for you, they're already doing it. You just make it more systematic. Having said that, before I jump into reputation, when you get people there, that is, you're ready to hire them. They're ready to go to work for you. Before that, keep in mind you can do a realistic job preview. Let them kick the tires, if you would. Have them, in fact, come to the hospital for a couple hours. I'm not an attorney, but I will tell you, my attorney said that in those days, said the wage and hour law would permit us to have somebody in the facility for a couple hours, not working, but just watching the work being done to see what it's like there. They got to feel what it was like to be in the organization and the job they were going to be doing. We found some jobs where people would self-select and say, you know what, this is really not for me. I thought, for example, if I was going to work as a clerk in the emergency department, I didn't know that I was going to see that much stuff I really don't enjoy. And, it made for no turnover then. We didn't hire the person. Now this reputation thing. There's a lot of stuff put out there, folks, about how to build your brand. I don't like it. It's my impression. I think the expression works here. If you put lipstick on a pig, it's still a pig. If your organization has a stinko reputation, no brand will offset that. What really makes the difference is you get the reputation, then that is your brand. The question, why should anybody go to work for you? What do they get at your place that they don't get anywhere else? And if you're just one of the crowd, well, good luck, dudes. I got to tell you, that's not going to work well. Add to that, need to create a workplace, a culture that attracts and holds people such that our strategy that I used at St. Francis was to create a workplace that was so wholesome and enriching that people want to come to work here, and once here, no way they even think of leaving. Look at what the rest of the world is doing. A couple years ago, Jeffrey Pfeffer of Stanford, who's one of the top management theorists out there, he's done a great deal of really good work on management and how to do it and how to be most effective. He wrote a book called Dying for a Paycheck. In that, he said the fifth leading cause of death is work. Work in so many places has become so toxic that people are actually passing away. Can you imagine? Now, if you create a work environment that's wholesome and enriching, you trump all those places. And that is a competitive advantage that's way difficult to replicate. Build reputation, and then act like you deserve it. Let me tell you what we did. Okay, my background's industrial organizational psych. I can do these kinds of studies. I wanted to see why people were leaving St. Francis. We, in fact, found the fifth leading cause of people leaving St. Francis was what other people were saying was the first reason people were leaving their organizations. Management. I was disappointed that management even made the list. I said, I don't think that's good enough. We want to get it totally off the list. We do not want people leaving because of their boss. That's a dumb reason to lose employees. We got to go to work on management. And boy, do we go to work. Based on advice from the people who have been there more than 30 years at St. Francis, we started saying, what do we need to make this place so incredibly attractive, to enact that strategy, to create that culture? Our strategy was culture. Having said that, we started off based on the recommendation of the 30-year group to start having high-quality conflict. And I did in-house mediations. We got about a 98% success rate. I was really pleased with that. But that left us 2%. Now, typically, as a mediator, I would tell people, well, you know what, you got to go back to your employer and deal with those 2%. Well, I was the employer, so I had to deal with those too. Now, having said that, let's go back to quality and dig a little deeper. conflict is, I go back to conflict, that is, and dig a little deeper. Conflict is, in fact, a problem wrapped in distressing emotion. 2 + 2 = 4 is a problem. It's not a conflict. Unless there's distressing emotion, it's not a conflict. Having said that, once you do have a conflict, you have the 2 elements necessary to create a conflict. Our most common approach to conflict is to avoid it, which means that problem that you're trying to deal with is now institutionalized. Big surprise, only 4 out of 100 companies make it 10 years or longer. If they institutionalize problems, it weakens the organization more and more and more, and you start getting, the sacred cows, the 300-pound elephant, all those sorts of 300-pound gorilla, I guess I didn't get it right. All these sorts of problems you have in these organizations that you don't need to have. Once a problem comes, you need to run to it, not to run away from it. In fact, after I work with an organization long enough, I start telling people, get there before the problem even starts. When you see it coming, we'll get there and fix it. So it doesn't turn into a conflict. You don't need the distressing emotion. That just diminishes the organization. And you solve problems before they become serious problems. We said a moment ago that there's 2% that I was not able to really address in the mediations at the hospital. According to the supervisors, they said 98% of the conflicts we were addressing were being dealt with in mediation, but they're left at 2%. And after we trained the managers on how to deal with conflict, how to have high-quality conflict, I did very little mediation. I only got the 2%. And the one thing that was obvious is mediation wasn't going to work. In fact, I had a whole array of conflict tools. None of them were going to work. I had to come up with something. And I thought, you know what, I know the answer to this, but I don't want to enter it in the computer because it's going to be awful. I'm really driven to be research-driven, I should say it that way. I am really research-driven. My master's degree is in experimental psych, so I love research. I've got to have data to convince me a good part of the time. Having said that, I wanted to see the data that whatever it was I was going to come up with would work. So I entered the thing that I was pretty darn sure was going to be the answer, the word forgiveness, hit enter, the computer almost exploded. And I spent hours and hours and hours digging to find research. I found Fred Luskin's work out of Stanford. He went to Northern Ireland, taught Catholics and Protestants how to forgive the person who murdered their family member, and hit it out of the park. I thought I can use this. So I took his book and turned it into training, added some things to it to make it more attractive, offered a training program called Forgiveness. Nobody showed up. So based on a recommendation, I called it grudge busting, got a full house, never changed a word. But we got people to understand that if you have high-quality conflict, you will solve the problem with the minimum of residual hard feelings. Those hard feelings don't have to become part of the scene. They can be gone through very simple tools of forgiveness. We teach people how to forgive. When that happens, you are at peace. So we taught our people not only how to address problems effectively, but if you got hard feelings, get rid of them. Because if you don't, through forgiveness, if you don't, they add to future conflicts. They make future conflicts harder because you've decided you just don't like that jerk. I used to like him, but then he did that, and now I don't like him anymore. That really seriously impacts, I'm going to call it the interpersonal underworlds of every organization, unless you're having high-quality conflict and using grudge busting to get rid of hard feelings, and then it doesn't. Those two together we call being at peace, yet solving problems effectively. Next up, the folks at St. Francis said, I ran across a little ditty on research on happiness. This was the year 2001, and I asked, would this help? They said, well, worth giving it a try. And there's good research on how do we be happy. So I started teaching people the tools and techniques of happiness. And I learned two things. One, yes, they can become happier. I knew we'd hit it out of the park when corporate came in and said, what's with this place? Is everybody happy? And I said, well, no, and certainly not every day, but we do teach people how to be happy. Plus, there's something called emotional contagion. We catch the feelings of other people. If you're around somebody griping and groaning and bitching about the place, you feel like crap. If, in fact, you're around somebody who's really kind of happy, frankly, I got to tell you, it's just a delight. And I met some of you folks at Memphis, and the ones that were the most happy, you just felt good being around. The ones that were less happy, I still felt good being around, but not as good. Get the difference? Emotional contagion. We catch the emotions of people around us. So if, in fact, your strategy is to build happiness in the organization, there's a very good chance you could reach a tipping point where the predominant emotion in the organization is happiness. Now, why would you care as an employer? Well, here's business. I'm a business guy. If we take the typical person's level of happiness and jack it up 12%, we jack it up, we increase it. We, in fact, find productivity goes up 12%. I get the right number in there. Okay. If, in fact, we compare that to people who are unhappy, if we compare unhappy people to the typical person, let's say it that way, they're 10% less productive. So for the gap between the unhappy person to the happy person is a 22% increase in productivity. Folks, if you want to increase productivity in your place, you can just make it harder on people and push them more and use incentives. But the research on this is clear. Increase happiness. And it's not all that hard to do. It just requires a concerted effort, and somebody's got to know what they're doing. And the research in the last, 15, 20 years has exploded. So we can do that. It's credible. There's people out there saying, you can't make other people happy. To a certain extent, that's true. But you can sure set the stage for it. For example, one of the top drivers of happiness is relationships. How do we relate to other people? Well, the big driver of relationships is trust. I've never heard anybody say, he's my best friend, I don't trust him at all. It just doesn't go together. In fact, when we have trust, we are setting the stage for the friendship. If the trust grows to a particular level, we'll say good friend. If we are single, we likely will pick out about 4 people on average to say best friend. If we're married, we'll say one person outside the marriage is a best friend, because we have found that if, in fact, you're going to have a very good marriage, that person you wake up with in the morning who has bad breath and scruffy hair needs to be your best friend. And the state of the friendship, state of trust, is what drives that. So having said that, you can see we could have some unintended consequences. I'm just trying to put together a training program to reduce turnover. And here we're talking about quality of marriage. Next up was resilience. Resilience is incredibly important, especially in healthcare. Because what you folks do on a day in and day out basis, I mean this respectfully, it's a little grim. I said this in Memphis. When we bring people in, we strip them naked, we inflict pain, and we ask them embarrassing questions. The difference between what is done in healthcare and what's done in torture is we mean well and we charge for it. I've never said, please, I want to go to the doctor and have all these things done to me, put hoses in places I don't want to think about and cut me and stick me with things. No, that's not a good time. And then there's cleanup. Ick. That's some pretty gross stuff. And then the emotional burdens associated with that. My goodness, I mean, we have a terrible story that came out of St. Francis. They made the papers. I'm not breaching of confidence. A dad in the community made the decision to beat his daughter to death, and it took him all night to do it. She was 2 years old. The nursing staff working ER and security were devastated. We had tough people. I mean, our security guard had been a cop for years, and he'd seen some pretty rough things. He sat and talked to me for 2 hours and said, I've never seen anything like that. That was just unbelievable. The thing about resilience is it helps you overcome hard times, and it sets the stage. It makes it possible for us to move forward. We will take risks because we're resilient. Moreover, the research on resilience shows that all positive psychological functioning comes from resilience. If you don't have resilience, you're going to have trouble even being rational. Certainly not going to have courage. And life is going to stink. It's just not going to be too good. Now, the second cousin twice removed of resilience is stress. We're spending $300 billion a year on stress-related conditions. I checked it out. It's a very credible statistic. You might go to the American Institute of Stress and scope that out. It's a really good site. 80 to 90% of the people going to the clinics in your community are there to see the providers because of stress-related conditions. We have diseases of civilization today that we didn't see before because of stress. If we teach people how to better deal with stress, which is, like I say, very close to resilience, then in fact, we are changing their lives in a very substantive way. Put those four together, happiness, stress, resilience, and stress, and we're talking about how do you have a good life? How do you enjoy your life? Now, I got to tell you, when I was recruiting, I went out with Mary and some of the other recruiters. We had two recruiters at that point in time. This was my role. I was to teach people what we did at St. Francis, and it worked. We'd have people standing at our booth at the job fair for most of the job fair, which meant they were not going to the other ones because they just wanted to hear what we were doing. From that came a new effort. We, in fact, said, what do we need to do to become, not just have a good life, not to just enjoy your life, but to have an exceptional life? And we started asking who in history was exceptional. When we got done, we concluded it's about goodness, because virtually everybody, more than 95%, said Gandhi, Martin Luther King, Christ, Mother Teresa. I mean, really good people in our lives, in our histories. They stand out because of their goodness. So, using my 6-year-old Patrick's term, the question became for me, how do we become a gooder person? And I found the work, I found the research. It's good stuff. From there, we said, how do you hit it out of the park? How do you achieve a state where it's about as good as it's ever going to get for you? You are doing what you are supposed to be doing in life. You don't see your job as work. You don't see it as a job about promotions and prestige and all that stuff. You see it as a calling. There's something called, oh goodness, what is it called? I just lost the name. I'll come back to it. Basically what it amounts to is you get to a point that you see the work that you're doing as what you're meant to be doing. And when that happens, your place changes. Your place in the world changes. The more people you have in your organization that see work as a calling. This is Amy Rosnowski's work out of Yale. Really changes the organization. The only thing is you can't jerk them around because they're truly dedicated workers. Mostly you point them in the right direction, then get out of the road, which is a nice way to manage. The question then became, how do we make this change? John Cotter of Harvard has said, you know what, folks, change efforts just don't work that well. There's over 80% failure rate on change efforts. Real problems with that. So I'm thinking, okay, I'm going to tell people they need to change so they can achieve this ultimate state of fulfillment, yet I can't come up with a change effort. Fortunately, I found Bob Quinn's work of the Ross School of Business at Michigan. He studied Gandhi, Martin Luther King, and Christ and said, what did they do that generated such incredible change? Well, I used his stuff, and I used the notion of transcendence because my sense, and the research on this is not strong, but it's pretty clear to me, that you achieve a state of fulfillment and you know you've hit it when in fact it doesn't matter to you anymore. I'm not worried about my fulfillment, I'm worried about your fulfillment. That's my focus. So I'm calling this transcendent change. How do you make this change? That's kind of cool. Having said that, we have people write a plan. We teach people how to plan the rest of their life so that they achieve fulfillment. And I'm hearing from a lot of people, it's pretty significant. Having said that, what I did was I went to the employers that I'd worked with and said, would you go to your people and ask them for input? If they think this program smells, if it was lousy, if it was crummy, I'm fine with it. No, I'm not fine with it, but, oh, okay, I want to know it. What's weak, what's good, etc. I didn't get weak comments. Mostly if I did, it was like the chairs are too hard, or sometimes the training takes too long, or sometimes the guy doesn't talk loud enough, or things like that. But what I got for the positives, I just grabbed some, and to a certain extent, these were more or less at random. I didn't just pull them up because these are the best ones. Having said that, listen to this first one. One of the participants, who's a director, and these are pretty much all managers and directors, said, we now focus more fully on the purpose of what we do. As a result, we find more meaning in our work. Research on this is pretty clear. We start looking for meaningfulness when we're teenagers. And it's just way cool. If we're finding meaning in our work, you don't have to worry about loyalty because they are where they're meant to be. That becomes extremely important. Let's drop down to we know how to achieve positive results from difficult situations. We've opened up lines of communication. As we talked in Memphis, communication in most organizations doesn't work real well. This helps. We don't have much conflict. We identify problems and we fix them, which is the ultimate in conflict resolution. They don't turn into a distressing emotion. You fix the problem before everybody gets distressed about it. That's smart management. Listen to this one. Learning more about communication and compassion has brought the employers closer together. What's cool about this one, I never taught about compassion. I never said anything about compassion, but they heard the message. Another one, conflict, happiness has increased. So for those folks out there that say it's not possible to increase the happiness of other people, well, these places. This one said, we can better deal with stress. The fact is, in healthcare, we have a stressful job, but now we don't feel so alone in the stress. There's more sense of community, and people share more with each other, so we don't each have to carry the burdens by ourselves. Stress is a shared phenomenon. I will tell you, in every organization I've worked with, stress is at most moderate. With that, they said we're more resilient. They've said we have a common purpose. We're on the same team, and this is what I really liked. Some have said this is the best group of managers and directors and staff we've ever had. I'm just going to go to the last one on this. You folks can read these because you're going to get the videos later after we're done with this. This one person who's a director and a pretty significant player in this organization, I'm just going to read the last one because this is a fully unintended consequence. Many of the conversation we have had resulted in improvements at home with my family. For example, my marriage has improved due to a substantial reduction in my stress at work. I can't thank you enough for this. I can't think of anything more important than this. We're finding people's home lives are improving, and that makes perfect sense. I mean, if you teach people how to be happy at work, how to be resilient at work, how to have good quality conflict, how to get rid of grudges, they don't forget it when they go home. In fact, what we're finding is they make a purposeful effort to teach their families, including grown children. I have people who buy the books that I recommend for their grown children, and then they talk about them after they've all read them. The idea is to improve the entire family. Having said that, you got to know when to hold them. The most common time people quit, first 180 days. To hold them, get preceptors going for you. Have a preceptor training program and run preceptorships. Absolutely. Hardcore rule against no eating the young. I'm married to a nurse. She was an ICU nurse for years, worked as a nursing supervisor, became director of nursing, et cetera, et cetera. I've been around healthcare for over 40 years. I think the world of nursing, and they have a little weirdness. They talk about eating their young, which means, in fact, they abuse new employees. Now, worked with a physician practice, about 10 doctors. Their 180-day turnover of RNs, just RNs, was 84%. They said, oh, my God, and they didn't even know it because they weren't tracking their data. And I said, they said, what's that mean? I said, in 5 years, you'll be out of business. Right now, you're complaining, your people are complaining so bitterly about having to work so hard. We're fully a third of the RNs you have employed are not employed, meaning they're brand new, they're really not able to make a difference, or they're on the way out, or the position's sitting open. So any point in time, 1/3 of your RN positions are non-functional. You got to fix it. When we got that turned around, they saved in a pretty short order about a little over $200,000 just in turnover costs. Once you get them past that period of time, you got to keep them longer. Bear in mind, the most common time to turnover is the first week in most organizations. Then comes, 90 to 180 days, then 1 year. If you get them to 1 year, good chance you'll get them to 3 years. You get them 3 years, good chance you get them 7 years. Get them 7 years, good chance you'll keep them for a very long time. Our average tenure at St. Francis was 7 years. I thought that was way cool. That's when I left. And then you got to keep them longer. Why are they leaving? And then fix it. I don't really get so excited about exit interviews. Research shows, and my experience would suggest this, that most people don't want to burn bridges when they're going out the door. So they say something like, well, I got better pay. often they don't get that much better pay. And if you go back 6-8 weeks later and do the exit interview, you get a different answer. But they just don't want to burn bridges. And the ones who do want to burn bridges, they want to like nuke them. They don't want to just burn them. They don't ever want to come back to work there. So that's not terribly helpful either. The interviews that do work are the stay interviews. They ask the people who are staying there, not who is talking about leaving, what do you hear about people thinking about leaving? What's going on out there? Well, if you were to leave, why would you leave? And are you seeing any of that right now? Learn about grounded theory studies. Grounded theory studies, we had 50% turnover RNs in our home health department. We brought in a computer software, and our corporate buddies took us. I don't assume responsibility for this. They brought in a new compensation system at the same time, and the two clashed head-on. We lost half of our RNs, and they were telling us things like their families were doing interventions saying, you need to quit, which is disturbing. The boss called me and said, what are you doing in home health? And I said, well, nothing, because I'm not assigned to home health anymore. And he said, you are now. I said, how did that happen? He said, I just got put in charge of home health. So I said, okay. We announced a grounded theory study, which means I interviewed every single person in home health that was an RN, and a lot of them who knew about what was going on with RNs, and which made for about 50 interviews. I kept copious notes. I put the notes all on the computer. I then moved them around. There's comments around and around until they all clustered together. At the end of that time, I knew why they were leaving, and we fixed it. Now, having said that, one thing we learned about doing these studies is as soon as employees got the idea, this meant we were serious. We were going to be fixing stuff. Turnover stopped. When I started the grounded theory study over in our home health department, turnover stopped for months, which was amazing. Also, get yourself a 30-year club if you can. We had employees who lasted there longer than 30 years. Lasted, funny word, but they stayed employed for 30 years plus. And if you hit the 30-year period, we had a party right around Christmas time where you were invited in to the 30-year club. And you got to meet with the people who've been there 30 years or longer. And maybe you'll use 20 years, maybe 15 years, but use something. These people became great touchstones for institutional memory. They knew the place. Now, do you quit working with an employee just because they quit, just because they leave? The answer is no. Stay in touch. They might come back. We bought the other hospital in April of 1987, and we lost bucket loads of employees. We thought we'd have a year before we'd have to start recruiting. We got like 2 months. Had so many people leave. They just did not want to join our organization. We got most of them back. But part of it is we recruited them back. They discovered we were a pretty good place to work. And the Retirees Club. These folks can serve in so many ways, and it's really wonderful for them. One of the problems we have with retirees is loneliness. We can keep them attached to the world of work, which gives them anchor, gives them a sense of meaning, and they can make a difference, and they can really help you with recruiting. The metrics show it work. Right now, employee engagement, we're spending about $750 million a year on employee engagement. Nothing's changing. Yeah, actually it is. It's dropping. $750 million a year, and it's going downhill, except at Saunders Medical Center in Little Wahoo, Nebraska, out of about 4,000, on a Price-Ganey survey, they went from 55th percentile of employee engagement to 94th. Lexington Regional at Lexington, Nebraska, I got there on a Monday. The Friday before, all doctors but one and 2 nurse practitioners for a town of 10,000 people resigned privileges. They did not leave town. They took their patients out of town to a hospital 15 miles away. The month before they resigned privileges, that particular doctor group, the gross revenues were $1.8 million. About 18 months later, there were $3 million. Now, 4 years out, they're running $4 million. Turnover, 58% drop at, again, Saunders Medical. About the same at St. Francis. We were saving about $2 million. That's a pretty extensive study to figure out how much you're saving, so I didn't do that at Saunders Medical. But at St. Francis, we were saving about $2 million a year. Return on investment in this effort is 10 to 1. If you do the right recruiting and retention sort of work, the payoff is massive. At St. Francis, we got job vacancy to 2%. And the total number of applicants, not total number of applicants per opening, but total number of applicants, saw a 200% increase. And that happened before the Great Recession hit. We started this in 2001. stopped December of 2010. Well, I shouldn't say we stopped. I should say that's when I left St. Francis. Having said that, what we basically found, in fact, was that people were, it was working, just working incredibly well, just phenomenal. Now, we need to let people know. Back when our newspaper articles were the gold standard, today they're not. The readership in newspapers has dropped so much. Still worth working with newspapers, but it's even harder to get articles into the newspapers, unfortunately. So you're going to have a web page will be one alternative. I did a lot of presentations. I went to MedTech conferences. I went to nursing conferences. I went to X-ray conferences. I mean, anything I could get into to do a presentation just to talk to them about stuff like we're talking about right here. What's it like to work at our hospital? What reputation are we earning? And publications. Get them out there so people see it. Now, this becomes important. As soon as you start this, I shouldn't say soon, as soon as people start seeing you're getting pretty incredible results, there are going to be folks saying, I want in on that. And they'll start doing copycat sort of stuff. In the world of manufacturing, and I used to teach business, I still do, I guess, only now it's adjunct, we told our students that, 6 months, you come up with a new idea, in 6 months it will be replicated. Having said that, to deal with that, we taught people not just effective decision making, we taught them creativity. And boy, did it pay off. The rad techs got together and decided to use a toucan as their muse, the thing they were going to use to generate ideas. So they wrote down everything about a toucan they could think of, every characteristic of a toucan, and then they said, how does that characteristic of a toucan pertain to recruiting rad techs? And after they got done with that, which took them a better part of an afternoon, we rebuilt our recruiting system for rad techs, and it worked. I also advocate a Skunk Works. Skunk Works are little in-house, pretty informal, incredibly creative teams. They really are shooting for the off-the-wall, way to heck out their ideas as to how to recruit. That's just way different and hopefully incredibly effective. Now, I'm going to tell you, and I'm going to wrap this up. If you're going to be successful in recruiting and retention, it is a story of innovation because you can't do what everybody else is doing. You've got to stand out in some way. Reputation is a critical element of this. And you've got to live your reputation. I happened to hear Warren Buffett make the comment. He said it took us 45 years to build a reputation that we could be trusted, that we were honest people. He said we could destroy it in 45 minutes. That's the message. Don't mess with your reputation. Don't worry so much about your brand. That's putting lipstick on a pig. Worry about your reputation. Make sure it's a good one, and your people will tell you what it is, and the people in the community. I grew up in a town of 300. We knew what was going on at the hospital in the area, and our hospital was 10 miles away, but we knew a lot of our people in that community worked there. And it had a reputation. Not a bad one, fortunately, but you can find a lot about your place just by talking to people. With that brings me to how do you get a hold of me? Oh, by the way, the Elliot has 2 T's. So if you want to get me, it's not lee.b.elliot with 1 T. It has 2 T's. I just noticed this. Okay? Feel free to get in touch with me. This is my hobby. I like this stuff. That's why I'm still doing it, because it is really good stuff. And I've seen so many people have so much better work environments, so much better success at recruiting and retaining people, being therefore more financially successful, and just having a better life. It's an extremely rewarding thing for me to do. So don't at all hesitate to get in touch with me. With that, I'll stop. Anyone have questions?
As a reminder, you can use the chat box if you have questions for Lee, the chat box that everybody's been typing in their facility name, or if you press *2 on your phone line, that will unmute your line, and you can ask a question.
No questions?
I'm pretty quiet.
Sounds dead. Yeah, like not a whole lot. I wish you the best. And again, I want to stress, do not hesitate to get in touch with me because and you know what, if we're just going to talk on the phone or I'm going to send an email, guys, that ain't going to charge you. I'm not going to charge anything. And I'm a business of one, so I don't have to worry about that. But I would be most happy to chat with you about what you're doing, and if I can give you any ideas as to how to improve, glad to do it. Okay?
Okay. Thank you so much, Lee. We really appreciate you being on today.
For
everyone else, yeah. Sunniva had noted earlier, before we started, that this was recorded, and this will be also posted on our website. So we'll get that sent out to everybody for people who were not able to attend if they would like to listen to this recording and watch this. I again would encourage you as well to get in touch with Lee if you have any specific questions for him or have any follow-up. He's very available, and he's just, as you can tell, very lovely to talk to. So with that, we are going to go ahead and adjourn today's Hospital and Clinic Learning Collaborative. I wish all of you a wonderful rest of